Welcome to The Explainer. Today, we're diving right into the progression of treatments for anterior eye disease. We're mapping out the whole journey, literally tracing the steps from those simple, everyday home remedies all the way up to cutting-edge medical physics and lasers.
Now, it all kicks off with one fundamental question. What happens when simple eye drops just aren't cutting it anymore? You know, we've all had irritated eyes, right? You reach for an over-the-counter drop and boom, instant relief. But when the eye's anterior defenses are compromised by something a lot more stubborn, well, the medical interventions have to escalate. And that escalation process, that's exactly what this explainer is all about.
So here's our roadmap for today. First, we'll look at first-line eye defenses, then tackling long-term chalazion. After that, we're weighing injection versus surgery. And finally, the SLT cold laser.
All right, let's jump right into part 1, first-line eye defenses.
So, most anterior eye diseases start right here at the baseline. Initial treatments typically kick off with basic hot compresses, just to promote that natural drainage. But if that's not enough to do the trick, we escalate. First to topical antibiotics, and then, if we're dealing with some really entrenched inflammation, we move up to systemic antibiotics, like Ceflix. It's a stepped approach, right? You start gentle and work your way up.
Moving on to part 2, tackling long-term chalazion.
So, what happens when things don't clear up? Well, a long-term chalazion is essentially a blocked eyelid oil gland that just stubbornly refuses to clear. It often presents as this annoying chronic nodule. And sure, while it might drain spontaneously on its own, it very often just persists, completely outlasting those initial hot compresses and antibiotics we just talked about.
Now, this brings us to a crucial, absolutely vital medical caveat that we really can't skip over. If a patient is dealing with recurrent lesions, meaning, these nodules keep coming back over and over again, doctors have to take it seriously. Recurrent lesions need to exclude a sebaceous gland carcinoma. It's a mandatory safety check. Before anyone just assumes it's another stubborn blocked gland, the medical professional actually has to rule out this specific type of cancer. It really highlights exactly why a professional diagnosis is so vital when these symptoms just won't go away.
Okay, part 3, injection versus surgery.
Let's break down the two big options clinics use to tackle these stubborn nodules. On one hand, the triamcinolone steroid injection is fantastic because, well, it's non-invasive. You often don't even need a specialist referral for it. The doctor just injects exactly 0.3 cc parallel to the lid. On the other hand, we have Incision and curettage. Now this involves physical, surgical drainage, followed up by hot compresses. And nowadays, it even sometimes incorporates newer treatments like IPL or intense pulsed light.
Now, you're probably wondering, so which one is actually better? Well, here's a myth-busting fact that I absolutely love sharing. Surgery and injection, they have statistically similar effects. Seriously, no way around it. That is incredibly empowering to know. You'd probably naturally assume that the more involved, invasive surgical drainage would automatically give you better results, right? But the data actually shows that the quick 0.3 cc non-invasive steroid injection works just as well statistically. It literally changes the entire game for how a patient might approach their treatment options.
And that brings us to our final escalation, part 4, the SLT cold laser. To really understand SLT, we have to look at the core principle of thermolysis, which relies on something called thermal relaxation time. It's a pretty elegant concept, honestly. It's all about delivering energy so precisely that the target tissue is treated, but, and here's the kicker, it has time to relax before heat can build up and damage any of the surrounding areas. So, inside the eye, this translates into a highly precise microprocess. Step 1. The laser pulse duration is incredibly quick, like a microscopic fraction of a second. Because it's just that fast, Step 2 kicks in. The eye's melanin literally cannot convert the laser into heat energy. It just doesn't have the time. And that leads directly to Step 3, zero thermal damage. No heat buildup means no burning, which is exactly why they call it a cold laser. You're getting all the benefits of an advanced laser intervention with none of the destructive thermal side effects.
But you might be thinking, why even engineer a cold laser when we already have topical eye drops? Well, it actually comes down to a deeply human reality, patient compliance. The data shows that patients are just way more compliant with a single SLT procedure than with a strict daily regimen of topical drops. I mean, let's face it, people forget, drops can be super annoying or uncomfortable to put in. Sometimes the high-tech laser is the better solution simply because human memory isn't perfect.
Which leaves us with this final, kind of provocative thought. As cold lasers replace the need for daily eye drops, what other daily routines will medical tech eliminate next? We have literally journeyed from a basic hot washcloth compress all the way to microscopic bursts of light that don't even have time to generate heat. It completely transforms how we think about healing. I hope this explainer has illuminated just how dynamic the progression of anterior eye disease treatment truly is. Thanks so much for joining me, and keep questioning the world around you.